My name is Sarah Beloudian and I'm a senior psychologist from PSCC. In collaboration with Ministry of Public Health and Hamad Medical Corporation, we launched a helpline to support people experiencing anxiety and depression and mental health problems during COVID-19. I was part of a team of professionals providing support to this kind of population. In only 6 months of operation, the helpline managed more than 12,000 calls.
As a member of the Information Systems team, I participated in the delivery and management of the technological requirements for the COVID-19 response. The IS team continues to support responsive plan through all its stages, including setting up of the technical requirements for health inspection and quarantine facilities. In addition to working closely with tracking and tracing team to ensure timely communication of test results to patients.
دكتور مشعل عبد الله المسيفري, consultant family medicine, Al-Wajba Health Center manager. At Al-Wajba Health Center, we introduced a drive-through service for COVID-19 testing to enable people a fast, safe, and easy process for having their COVID-19 swab test. Myself and my team worked hard to establish this service so that anyone requiring a COVID-19 test in Qatar was able to do so without delay. By ensuring people are tested early, we have been able to provide them with any required treatment without delay.
Amir Al-Khatib, charge nurse, Hazmin Barik General Hospital, the Nursing Division Critical Care Department. Our comprehensive plan to expand the hospital capacity to meet the increased demand from COVID-19 delivers significant expansion of intensive care services, more than tripling ICU capacity to over 700 beds across our hospital system. Hazmi Barik General Hospital, the main COVID-19 hospital, increased its ICU capacity from just 8 beds to 226 beds. Being able to provide these patients with intensive care support without delay has been the difference between life and death for many patients. This is evidenced in the mortality rate for COVID-19 patients admitted to ICU, which is one of the lowest in the world.
Rami Gharib from Ambulance Service. Myself and my colleague in the ambulance service delivered services including the safe transportation of confirmed or suspected COVID-19 patients and medical services within the industrial area. We assign ambulances exclusively to transport COVID-19 patients, and our paramedics are fitted with full personal protective equipment to keep them safe from potential infection. In addition to our frontline role in COVID-19 measures, ambulance service staff continue to transport and to respond to hundreds of non-COVID-19 emergency calls every day, providing life-saving treatment for many non-COVID cases.
My name is Ihsan Kamal, Senior Graphic Designer. As part of the public relation team working with the colleagues at HMC and PSCC, I participated in the implementation of the communication strategy, implemented across all stages of the COVID-19 outbreak. The key principles underpinning our communication strategy are to be open and transparent, to be consistent and clear, to provide regular and timely information.
Dr. Iman Radwan, Healthcare Quality and Patient Safety Department, Ministry of Public Health. Our healthcare system readiness, capacity, and performance has always been monitored to ensure that we are able to cope with any unexpected surge of cases, and interventions were put accordingly.
My name is Omar Ahmed Al Hassanat. I'm a head of Infection Control Department in Hamad Medical Corporation. Myself and my colleagues in the infection control team across the healthcare system worked hard to make sure that the infection control protocols were developed to limit any cross of infection. These protocols help to prevent the spread of viruses and make sure that there is a safe environment within the healthcare facilities for both staff and patients who still needed to visit them for care. Infection control team also played a key role in increasing public awareness. My name is Omar Ahmed Al Hassanat. I'm a head of Infection Control Department in Hamad Medical Corporation.
دكتور أشرف حجاج, Consultant Family Medicine, PHCC, مدينة خليفة Health Center. In response to the emerging of COVID-19, HMC and PHCC reacted rapidly and established a new services, which is telemedicine and virtual consultation, to be sure that patients, especially at-risk patients, will be able to get their care throughout the pandemic. Actually, I was very lucky to have the opportunity to be a member of virtual consultation at HCC, aiming to provide services and medication delivery to our patients.
Dr. Ali Abdullah from Ministry of Public Health Department. As a member of Public Health Department at Ministry of Public Health, I'm supporting the effort of COVID-19 contact tracing. Contact tracing aims to reach the close contact people for the positive cases as early as possible to help the break in the chains of the transmission and reduce the spread of the infection in the community. The early detection of positive cases play a key role in the slowing of the spread of the virus. It's also allow for early treatment when needed, which has helped Qatar to maintain one of the lowest COVID-19 mortality rates on the worldwide.
My name is Nimisha and I'm from Communicable Disease Department inpatient. As a member of the nursing team at the Communicable Disease Center, I was on the front line providing care to patients with either suspected or confirmed cases of COVID-19. Our nursing teams provided care to all patients with moderate to severe symptoms in our inpatient wards at CDC and 6 other HMC hospitals designated as COVID-19 facilities. By quickly providing these patients with a hospital bed and early medical treatment, we were able to help them manage their symptoms and reduce the development of complications.
دكتورة نيلة درويش سعد, Manager of Salal Health Center. At the start of the virus outbreak in Qatar, Salal Health Center was designated as one of the 4 COVID-19 test and hold health center. Since then, myself and my team have been working hard to enable anyone who meets the criteria to come to our health center to receive COVID-19 test in a safe environment. Enabling people to easily access COVID-19 tests has been a central part of our strategy to identify cases early.